Okay, all right, well, good afternoon, everybody. It's hard to see through all the people here at the moment, but anyway, good afternoon. So my name's Matthew Philpott, and I'm Executive Director of an organisation called Healthy Stadia. I'm here with my colleague, Dr. Chris Bunn from the University of Glasgow today. And we're going to talk you through some of the latest developments in terms of creating healthier stadium environments and also some health promoting interventions, in particular around men's health, that Chris is going to talk through in the second half of the presentation as well. So a bit about Healthy Stadia, our organisation. So we're an NGO, we're a charitable NGO with over 10 years experience in this cross-cutting area of health, sports, facilities management and research. And we basically provide guidance and training for clubs and associations on the adoption of health promoting policies and practices at their stadiums. We have a key partnership with UEFA. We're an associate partner for their health portfolio, and that's with another partnership with the World Heart Federation. And we do an awful lot of work in terms of their tournaments. So we do the health programs for the Euro, the men's Euro in 2012 and last year in France. And we've also just finished a piece in Holland for the women's Euro around active travel, which I'll talk you through about in the next couple of slides. So what is Healthy Stadia? What is the concept behind this? Well, the definition we give to it is that Healthy Stadia are those that promote the health of visitors, of fans, employees, players, and perhaps most importantly, the surrounding community. So the idea is this is a holistic approach to developing sports stadia as health promoting settings. So it's not just foundation trusts who do integrated work with their communities around interventions. It's not just about staff health. It's about all of these areas coming together to form a health promoting hub within communities. So that can be healthier match day environments, that might be around tobacco-free agendas, healthier food options. It's promoting healthier lifestyles for fans and local communities. So we'll talk a bit about men's health and also around staff well-being and health. So just a brief video now. It's basically, why are we doing this work? We're trying to basically combat what are called non-communicable diseases, which have risen hugely over the last 20 years. So we're talking about things such as cardiovascular disease, heart disease, cancer, stroke, type 2 diabetes, COPD. These are all areas that with simple changes in terms of people's lifestyle and simple changes to environments such as sports stadia, people can actually start to at least reduce the prevalence of some of these diseases such as heart disease. And we're working with the World Heart Federation this year on World Heart Day, and this is a short video that the football family across Europe are going to be showing on the 29th of September around heart health and football. Please. Okay, so that's for World Heart Day, 29th of September. We're going to be having around about 20 to 30 national associations under the UEFA umbrella who are going to be promoting World Heart Day. Quite a lot of clubs as well. That's something you might well see on big screens at matches or through communications from national associations, certainly through UEFA, and we're going to be using some of our ambassadors, people such as Clarence Seedorf, Ian Rush, who are going to be helping to spread that message around those simple changes that I mentioned in the video. Simple changes to lifestyle, including giving up smoking, having smoke-free environments, being more physically active, and also eating healthier. Those small changes that can make a powerful difference. So how can that be affected at a stadium level? I'm going to look through three things, which is around active travel, around healthier eating, and also around tobacco-free environments. So we've worked for the last 3 years on the idea of promoting active travel, so walking and cycling to and from stadiums, and we produced some guidance on this 2 years ago and some 4 case studies which have been derived with our partner clubs and associations over the last couple of years. So effectively this is talking through how to develop walking and cycling routes, and in particular how to work with your key partners in terms of setting up these schemes themselves. It's to do with installing the right sort of cycle locking facilities at stadiums and making sure that they're properly signposted. And perhaps most pertinently, it's about actually promoting this through your club communication channels or your stadium communication channels. It's all very well to do this work around building the routes in terms of putting the right cycle locking facilities in. If you don't actually spread the word in terms of your fans that there is an easy choice, a healthy and sustainable choice around travel that can be made, then basically the uptake is going to be that much lower. So there's a lot of cross-working between facilities management, between communications that needs to go into this process. And one of our partners, this is one of our case studies, which is KAA Ghent. So this is a photo of their Galemco Arena in Belgium. KAA Ghent have an incredible 2,000 to 3,000 people cycling to their stadium each match. Can you believe that? How's about something like that taking place in the UK? That is over 10 to 15% of their overall capacity on a match day who are cycling to their stadium. This unlocks so much trouble in terms of traffic congestion. It promotes health, it's a sustainable activity, and it also promotes a better air quality environment. So these are all considerations as to why clubs and tournaments might want to look at active travel in terms of some of their stadium adjustments and operations. Just this year at the Women's Euro, we produced an active travel app which has incentivised walking and cycling to the tournament, to all of the venues across the Netherlands, and it basically used GPS technology to track walking and cycling journeys, and we incentivised that through prizes such as match tickets and tournament balls to get uptake amongst not just fans but also amongst stadium workforce and volunteers. So the results of that, you can see it on the slide here, over 2,000 kilometres that were tracked by the app in terms of walking and cycling, over 80,000 kilocalories burned, and perhaps interestingly, the most important thing is at the bottom here. Of the people who used the app, 38% said that they were more likely to walk or cycle to their stadium for their domestic fixtures. So this is something we were piloting in terms of the UEFA tournament, but this was a behaviour change that was going to be potentially brought home to their general kind of match day habits for their domestic fixtures as well. Okay, a little bit about healthy catering. Okay, so the traditional offer, these burger boys over here, it doesn't really matter whether it's in the UK or whether it's across Europe. Generally, it's fries, it's burgers, it's certainly in Northern Europe, a lot around like hot dogs, sausages and the like. The fact of the matter is the general matchday offer is still around produce, which is high in saturated fats, high in salt, high in sugars, and also obviously high sugar drinks and alcohol are a pretty standard sort of thing on a match day as well. Look, we don't have a problem with clubs who are offering this, but what we're trying to say is there has been a real distinct change over the last 10 years, whereby there are greater numbers of women and children who are coming to matches who may not share those type of tastes, but perhaps more importantly, there's been a cultural change in the last 10 years. People are far more aware of their diet. They are far more aware of general nutrition principles. There's a better understanding of eating healthier, eating fresher. And in fact, there has been a couple of pieces of research conducted by YouGov over the last 5 years, which is indicating, this statistic says there are 45% of fans who attend sports fixtures who want to see healthier and wider options available on a match day. So there is real kind of data that backs up this need for change in terms of supply. So one of the clubs who've done a lot of good work in this area is Chelsea FC. They've pioneered a sub 500 kilocal menu, which is using noodle pots, which is using wraps, fruit portions, flatbreads is a big seller of theirs, and this is making a big impact in terms of their bottom line margin. they're attracting new buyers, new customers, new segments to their catering offer on a match day, which is making a real difference to their bottom line. This isn't just a societal do-good thing that we're trying to actually promote. This is something which is a corporate option for clubs to look into. Okay, so how can we help with this? Okay, so we're going to be basically piloting very soon and launching next year what we're calling a healthier match mark, and that's going to be some online benchmarking and guidance that's going to be used with stadia catering departments, and we've developed that in consultation with Public Health England. And this is really about providing healthier options. Like I say, it's not about salad bars, smoothies, it's not about basically kind of, rabbit food. This isn't going to work. It's around reformulation. It's around basically trying to make traditional offers such as pies more healthier, having leaner produce in them, making the pastry less salt-laden, less fat in the pastry as well. It's about better cooking techniques, around oven techniques, around grilling, and if you are going to fry, following good practice in oil usage and frying techniques as well. I would suggest that probably the most important thing in this is actually around pricing and promotion. If you're going to have healthier options that are part of your match day menu, then if you're going to be putting them in at the same price as standard options, they're really not going to sell too well. You need to go in perhaps 10, 20, 15% lower in terms of some of these options. You have to be promoting them hard in terms of the first option that people see when they go to a catering kiosk. You have to have them high up in a fridge. If it's water you're trying to promote, having that above Coca-Cola, having that above high sugar drink versions that are in the fridge. So it's about different techniques, and this online guidance tool that we've developed is something which can guide stadia catering departments through this and offer them advice as well. I'm just going to finish on a few bits around our tobacco control work. In the UK, it might seem anathema, it might seem kind of almost outdated to talk about the idea of smoking in stadia. This is something that, and the UK smoke-free law basically was outlawed 10 years ago. In 2007, that law came into place. I'm afraid to say that this stat says nearly 70% of football venues in Europe still do allow smoking. This is not something that has gone away. And the second point I've made here, why are we still involved in this work? This actually, in terms of second-hand smoke in Europe, this kills up to 80,000 people a year. Not in stadiums, clearly not. But, you've got 70% of stadiums, you've got young people, you've got children who are inhaling pretty poisonous, toxic smoke that have real serious effects in terms of bronchitis, in terms of emphysema, in terms of long-term cardiovascular problems. This is something that we're really working hard, in particular with UEFA, to eradicate. And a lot of clubs come to us, and a lot of national associations say to us, but look, this isn't part of our national legislation in terms of tobacco legislation. The fact of the matter is, they can actually integrate this into their stadium regulations. The classic ground regulations that you'd see outside a ground, i.e. the conditions of sale for tickets, the prohibited items, prohibited behaviours. This is something that they can do under their own volition. And in fact, Barcelona did this in 2012. This is their smoke-free campaign that they ran to sensitise people in 2012. There's a very weak tobacco control law in Spain, and they went out kind of sticking the neck out. They wanted to make their stadium, Camp Nou, a tobacco-free stadium to promote the health of all fans and workers at the stadium. And this was actually very well accepted amongst the fans and has been embedded into their practices for the last 5 years. So we produced this guidance document that basically talks through consultation with fans and stakeholders. It talks about how to develop an effective timeline and policy that can be put in place, how to communicate that through signage, through press releases, how to train your stewards, how to enforce this programme. There's lots of case studies and signage examples and templates within the guidance, which is now available in French, German, Spanish, Italian and Russian language, which will be used for the World Cup next year. This has been used by the Belgian Pro League this season to implement their own tobacco-free policy across their games. So, just to finish on this, we ran UEFA's tobacco-free programme last year at the Euro in France. Again, France does not have tobacco control law which prohibits smoking in stadia. So we used a kind of soft approach. We trained up 110 what we call Respect Your Health volunteers, and they used this yellow and red card system. Here are some of our volunteers down at the bottom. with their yellow cards, obviously your yellow and red card that you normally find in football, a simple warning around the smoking restrictions that are available in stadia, really talking people through the reasons why we were doing this. There was a health imperative to protect the health of all of the stadium users, and we had some pretty good results from this. Very low smoking incidents in seated areas, and a lot of warnings of yellow card, but very few repeat offenders after that as well. So just before I hand over to Chris, I'm just going to turn attention more towards community interventions, so fan and community interventions, and the importance of working with research institutions, the importance of data and building an evidence base for this work. So there's been a lot of work over the last 20 years with football foundations, working with fans to promote health, but I think we're moving to a new phase now where there's a growing engagement with academic research partners to basically have an evidence-based set of data and measurements that can go with programs. And Chris is going to talk you through some of this in terms of the Eurofit program that we run, but to give you a taster on that, I'm going to show this video which introduces you to the program. It's something that's being run in 4 countries at the moment, and basically this is the Eurofit program video, and Chris will talk you through that program now.
We're all aware of the positive impact that a healthy diet and regular physical activity can have on our lives. We also know that remaining fully committed to a healthy lifestyle is often not an easy task. What if the football club you're passionate about could lend a helping hand?
If your wife tells you to go to the doctor, you go, no. But if your football club tells you to go to the doctor, you go to the doctor.
Omdat het mijn club is, ten eerste. En omdat ik met z'n allen wat wil bereiken.
This is the premise behind Eurofit, a program that encourages sustainable changes in diet, physical activity and sedentary time in a large number of football fans across Europe. Eurofit is a research study funded by the European Union. It brings together scientists, public health experts, private companies, 15 professional football clubs, and most importantly, their fans. Elite clubs from Norway, the UK, the Netherlands, and Portugal start by recruiting a large sample of volunteers from their huge fan bases. Next, coaches from the clubs provide these participants with guidance and a variety of tools for behavioural change based on the best scientific research. The programme goes on for 12 high-spirited sessions where fun, camaraderie and a willingness to learn and improve are always present. With Eurofit, participants have a unique experience. The club they've cheered for since they were little invites them back into their stadium, this time to help change their lives for the better, with the same team spirit and enthusiasm as ever.
Don't count your days, make your days count, and really that's how it's made me feel, really.
Para mim, o futebol é resultado fantástico. Eu consegui mesmo mudar muitas coisas na minha vida.
I'm more conscious of what I ate, I'm more conscious of taking more steps throughout the day, and also spend nothing.
O aparelho que nós usávamos para nos obrigar a estar de pé mais vezes durante o dia foi hábito bom que se criou.
Altijd fanatiek sporter geweest, maar het wordt tijd dat ik ook eens ga denken aan mijn eigen gezondheid. Dus ik denk een groep met gelijkgestemde misschien in de volgende.
I'm actually 6 kilos, I have to target like 100 kilos, rather than it's only.
With 30 million fans all over Europe, it's hard to overstate the power of football, especially for men. In Eurofit, our goal is to channel that power towards a more healthy, active and happy Europe.
Okay, thank you very much, Matthew, and thanks for showing our video. We're very proud of that. A lot of effort went into making it. I'd like to welcome to the stage John from Manchester City, who is one of our participants in Eurofit, and Mike Salah from Everton, who's going to comment on Eurofit as one of the delivery clubs as well. Now, I'm just going to talk you through a little bit about where Eurofit came from. It began as a study in Scotland called Football Fans in Training. We started this work back in the late noughties, 2008, 2009, And at the time, we were aware, as I'm sure all you are, of rising levels of obesity across the globe. And at the time in the UK, we were aware of this trend. So in 2003, you can see that the entire country is around 20 to 23% of people falling into the obese category. By 2005, that had risen significantly, particularly in Scotland, and we were working in Scotland. And we know, as I'm sure you guys do, of the effects that obesity can have on health. It can cause hypertension, it can increase your risk of type 2 diabetes, some cancers and other conditions. So we thought, well, how are we going to help men in Scotland to achieve some weight loss and to reduce obesity in the country? We thought about going to the football clubs, and we created Football Fans in Training. And it's a weight management program that is delivered over 12 weeks by community club coaches. It's free of charge, it's based in a group, and your group members are fellow fans more often than not. It's based around a 90-minute program for 12 weeks, and it involves an incremental pedometer-based package of physical activity homework to increase physical activity over the 12 weeks, and also a range of behavior change techniques. And finally, it was sensitized for men. So the idea is that we didn't focus on this program being a diet per se. It was more about just being a bit fitter and a bit more active. And we made sure that the content was very interactive. So the guys didn't have to show up every week for a lecture. They showed up to be engaged in the discussion and learning that was taking place before going on to do physical activity. The results of this study were incredibly successful, and we published them in some of the leading journals in the medical and public health worlds. We attracted men with an average age of about 47, with an extremely high BMI of about 35 on average, which puts those participants at risk, a very high risk of future disease. Most of them had a very high blood pressure, so that's the rough average figure for the cohort at baseline. So that's actually a clinically problematic level of blood pressure. And finally, we were able to attract people from across the socioeconomic spectrum, which is very important when you do health interventions. Often we find that health interventions attract middle class and upper class people who are already quite well off and their health outcomes are good. We wanted to make sure that our program reached those who perhaps didn't have the money to participate in conventional weight management or physical activity programs, and we achieved that. We ran what's known as a randomized controlled trial. I'm just going to give you the highlights from that study. The guys in the intervention group lost about 5 kilograms more in weight than the control group, and that was measured at 12 months, so from baseline to 12 months. These men lost just shy of 5% of their body weight, which is clinically significant and has great benefits for health. The reduction in blood pressure was much greater in the intervention group. So too were the improvements in diet and alcohol consumption, and physical activity was increased, and better mental health was reported amongst our participants. So that project came to an end. We published the study in the Lancet, and we received a lot of attention. The program, the Football Fans in Training program, has now spread to other countries, including Germany, and has been adapted for use in ice hockey in Canada, rugby in Australia and New Zealand, and we're looking at some others. But we wanted to see what this approach could do in Europe in a more broad setting and with some slightly different outcomes. So we designed this study that we've called EuroFit. And it was funded by the European Union. And we put together a team from across the Netherlands, Norway, Portugal, and the UK. And the names of our partners are just there. And these are the football clubs we worked with. I'm not going to name them all, but here in the UK we worked with Arsenal, Everton, Newcastle, Man City and Stoke. and they were one of 15 clubs that participated in the study. And the study was a response to another risk factor for non-communicable diseases, which has only recently been established in the literature. And it's been noticed that those who are highly sedentary or have low levels of physical activity are at risk of non-communicable diseases regardless of weight. So we were intrigued as to whether or not the Football Fans in Training program and the approach that we developed with that could be adapted and changed and developed using the most recent science that we had at our disposal, and also our new colleagues. We broadened our conceptual grounding, and we aimed to help our fans, our participants, to sit less and become more active. Now, why are we asking them to do that? And it's because we know that regular physical activity can reduce the risk of all of these health conditions and concerns. And also, we've recently established in the literature that sedentary time, the amount of time you spend sitting, is actually independently linked to a range of negative health outcomes, as you can see on the screen there. And we sought to intervene on that behavior as well. Now, how do we do it? It's a similar recipe to FIT, but with some additions. So the program is based on group learning. It has inbuilt physical activity sessions. There's a walking program, which increases the distance and the length of time that men spend walking during the week. And we use cutting-edge self-monitoring techniques, which were based around this device, which is called the Activator. At the time it was called SitFit, but it's been rebranded, so it's now the Activator. And this device tracks your sedentary time, your walking time, the time you spent standing, and it also provides vibration feedback in the pocket after certain durations of sitting. You can set it to 15 or 30 minutes. And it just offers a prompt to the wearer to move and perhaps break up their sedentary time. So, and this technology was developed as part of the program with a technology company based in Glasgow called PAL Technologies, who are the leading scientific instrument manufacturers in sedentary and physical activity monitoring. And finally, of course, we use some club magic, the power of the badge, or, in my case, Norwich City. Less magic happening there at the moment. Anyway, this is just a small slide to show the program in action. This is at Man City, and it gives a flavour of how the program works. Not only do these guys get access to coaching staff and the ground in ways that they don't normally gain that access, they get these sorts of experiences. This is where their team line up every Saturday or every other Saturday to play their matches. And there they are, stretching in that tunnel where many famous players and heroes of theirs have stood. So this is what Eurofit's all about. And we're in the middle of finishing the evaluation of Eurofit. We'll have our results soon. But we know FIT works, and we have a lot of confidence in Eurofit, because we think it acts as an access mechanism for fans into a culturally appealing environment that they do not normally get access to in the way that we provide. It makes making health changes simple and straightforward. There's not a complex Weight Watchers program to follow. We don't have points and sins and deductions and things like that. There's a straightforward evidence-based program that our participants follow. And finally, it's set in a group, and we think this is very important. It allows the men who participate to bond with one another, encourage each other, and it helps them to support one another in the long term. And finally, it's based, and I would say this as an academic, on good evidence. We use the latest behavior change technique taxonomy, and we integrated this with the latest physiology, metabolic science, and other disciplines. So we're confident Eurofit is going to produce a good result. We know that FIT already has. Watch this space for Eurofit results. You will see it in the near future. And I should also just mention, because I know I'm running out of time here, that Eurofit, even though we don't have results for it, has already been adopted in Portugal. So the Portuguese Football Federation and the Ministry of Health have signed a memorandum of understanding as of April 2017, and Eurofit is going to be integrated into their approach to supporting physical activity across Portugal. And at this point, I'm just going to thank my colleagues who were involved in the original study, the Football Fans and Training Study, which is funded by the National Institute of Health Research, and my Eurofit colleagues now. Thank you very much.
Thank you, Chris. That's fantastic. So we've got a couple of guys on today, as Chris mentioned. John from Man City is one of the participants in the programme. Mike Saller, who is the Director of Health and Sport at Everton Football Club. John, just turning to you first, could you just give us a quick overview of your experience of undertaking Eurofit, what it meant for you, and in particular, could you just talk us through some of the changes that you've made to your lifestyle since you've done Eurofit?
When I first actually started doing the actual programme, I didn't know anything about it. We sat in the classroom, run through a lot of things, mainly about changing lifestyle. One of the things that kept drumming into his heads is drink lots and lots of water. I don't drink alcohol anyway, so that didn't bother me. Then basically, we went through the classroom doing all about nutrition, find out what foods are good for you and what's bad for you, and then we did some exercise during the classes. That was how it started off, basically once a week, down at the Man City football ground, down at the academy and everything like that. Basically just exercise and basically run through nutrition, but it opened my eyes quite a lot. Like I say, I told you earlier, I lost about a stone and a half within 12 weeks, and it worked for me. But met a lot of new friends. DJ there from Burnley, he's in it, and these are all different lads. But we've all stuck together. Even after the programme's finished, we've carried on, and we play football on Monday nights now, and it's brilliant.
Can I just ask, do you think, what was the main driving force for getting involved in this? Was it the fact that this was a programme being put on by Man City, and the fact that you were able to go to the club and have some of these behind-the-scenes experiences? Would you have done something like this if it wasn't for the fact that it was associated with City?
Probably not.
Right.
Because it's the club that we all love, well, I love anyway. Basically, it gives us a chance to actually get involved and be at the ground doing stuff that we wouldn't normally do. It's been brilliant.
Fantastic. Mike, I'm just wondering from a club perspective, you've been involved in a lot of different health interventions over the last 10 years or so, but what was it different about Eurofit? What did this bring to you as a club in terms of meeting some of your objectives, in terms of meeting some of your indicators on health, and in particular men's health? What was new that Eurofit brought to your piece?
As you mentioned, we've delivered a number of projects which fall in our wider health and wellbeing programme, and I think with Eurofit it was something which was really pulling on the brand of the football club and the fans' real passionate allegiance to their football clubs. There was quite a wide age range, 30 to 65 I think it was, so it was appealing to a large audience. It was specifically for males. And it opened up the football club. It offered opportunities to access the stadium, access to qualified coaches, fitted to the training ground, which usually are very exclusive areas. And then also for ourselves, it was the strong association with the academic institutions too, working alongside Chris, and having that evidence being embedded into the actual delivery was very important to ourselves, so we could really kind of show what difference this is making to the programme.
Can I just pick up on that? Why is it so important to you as a club to be able to work with research institutions like University of Glasgow? What's the value to you as a club in terms of having those evaluations and that data to your hand in terms of sustainability of these type of programmes?
In terms of sustainability, one of the big challenges for ourselves as a charity is around funding. In the past, a lot of our funding has come from local authorities, CCG, prior to the CCG, the PCTs. A lot of that funding now is very scarce, if non-existent altogether. So we need to be able to go to funders and say to funders, right, if you provide this funding, this is what we can deliver, and we've got evidence here to support that. We've got real, robust, rigorous information, evidence to show that people who go onto our programme be dependent upon mental health services, for example. They could be obese, they could be inactive, they could be off the radar with their GP. Engaged with our programme, we can improve a number of different areas of lifestyle behaviour, help to prevent some of these stats that are being presented earlier in terms of the non-communicable diseases, and also then help people to move into training, education, employment. And when you look at social return on investment, it's those areas which brings back a huge amount of social return, social value. So having that evidence to support ourselves is vital, especially with the competition with other organisations, and not just charitable organisations, but also within the private sector.
Yeah. Okay. All right. And just to finish with John, if I hand back to you, John, have you kept it up?
Yes.
Yeah.
Like I say, play Monday nights football every Monday night. We play for an hour. It's not walking football. It's full on pace, 7-a-side. Play non-stop for an hour. The health side of it, yes, kept that up as well. Right. So yeah, it's looking good.
Okay. And so you kept the weight off and you kept your levels of physical activity up.
Yeah. I put 5 pounds on because I went away for 3 weeks, but it's not too bad.
You all have a holiday.
Yes.
Yeah. I think that's fair enough. Okay. Fantastic. Let's have a round of applause for John and Mike from Evans. Yeah. Okay. Thanks everybody.